Very good evening to all of you. Today we are going to do obstetrics and gynecology MCQ challenge. Why this subject is important? Number one, it has a lot of good chunk of questions, about 25 to 30. And number two is that you can score full marks in this subject if you practice the MCQs in and study the theory in the right proper manner, if you understand the concepts properly, and if you are able to solve the MCQs quickly, easily, and automatically, you will get very good score. So let's begin with the first question. Zygote with zona pellucida reaches uterine cavity by A 2 days, B 4 days, C 5 days, D 6 days. What do you think is the correct answer here? Zygote with zona pellucida reaches uterine cavity by A 2 days, B 4 days, C 5 days, D 6 days. It is 4 days. The role of human placental lactogen is stimulate milk production, B fetal breast development, C growth of fetus, D endocrine regulation. So the correct answer here is C growth of fetus. It provides the fetal nutrition by antagonizing the action of insulin in the maternal circulation, breakdown of fats and proteins, and transport of fatty acid and amino acid from maternal to fetal circulation. Potent angiogenic helps develop fetal vasculature, promotes growth of breast for lactation. So the correct answer here is C growth of fetus. Most common site of implantation of tubal pregnancy is A. Interstitial portion of fallopian tube, B. Isthmus, C. Ampulla, D. Infundibulum. So, most common site of implantation of tubal pregnancy is the ampulla. Now, what is the maximum propensity to rupture? It is isthmic in case of ectopic pregnancy, and minimum propensity to rupture is ampullary in case of ectopic pregnancy. Please click the link in the description box to join the ultimate 2-day Neet PG Breakthrough Blueprint class. It will be very helpful for you because it will cover all 19 subjects in a holistic manner on 2 successive days. The first 10 people who click the link in the description box will get this masterclass absolutely free. Please, after you get entry into the WhatsApp group, please stay in the WhatsApp group till you clear your NEET PG exam, because a lot of inputs will be given in the WhatsApp group that will help you score good in your NEET PG exam. During which gestational age is peak serum HCG level attained? A 7 to 9 weeks, B 11 to 13 weeks, C 20 weeks, and D 25 weeks. See, this HCG rises progressively from conception. The levels double on an average every 30.9 hours until the values reach 6,500 milli international unit per ml or 6,500 international unit per liter at approximately 8th week after the last menstrual period. After that, the rate of rise becomes individualized, peaking between the 60th and 70th day, that is 9 to 10 week last menstrual period. HCG decreases slightly between 12th and 16 weeks post LMP and then remains constant. So the correct answer here is A, 7 to 9 weeks. What would be type of presentation when engaging diameter is mento-vertical? A, face presentation, B, bro presentation, C, vertex, and D, breech presentation. What do you think is the correct answer here? It is bro presentation. What happens in bro presentation? The engaging diameter is mento-vertical. Bro is the rarest variety of cephalic presentation where the presenting part is bro and the attitude of head is short of that degree of extension necessary to produce face presentation. In face presentation, the presenting part is face. The attitude of fetus shows complete flexion of limb with extension of spine. The commonest position is left mento anterior. The engaging diameter of head is submentopragmatic. 9.5 centimeter in fully extended head or submentum vertical, 11.5 centimeter in partially extended head. So the correct answer is B, growth. Most common cause of secondary postpartum hemorrhage is A. Uterine inertia, B. Retained placenta, C. Episiotomy, D. cervical tear. It is retained placenta. Bleeding usually occurs between 8 to 14th day of delivery. Cause of late PPH, retained bits of cotyledon on membranes, infection and separation of slough over a deep cervicovaginal lacellation, endometritis and subinvolution of placenta site. It is retained placenta. Incidence of scar rupture in a subsequent pregnancy in case of LSCS is A 2%, B 4%, C 5%, D 8%. The risk of LSCS rupture is low, 0.2 to 1.5%. Even if it does occur, maternal death is much less and the perinatal mortality is about 1 in 8. Subpubic angle is A less than 65 degree, B 65 to 75 degree, C 85 degree, D 110 to 120 degree. It is 85 degree. Rule of Hasse is used to determine A. Age of fetus, B. Height of an adult, C. Race of a person, D. Identification. It is age of fetus. Hasse's rule is employed in calculating the age of fetus by its length. During the first 5 months of pregnancy, the length in centimeter is square of the age in months. Length in square, age in months. So the correct answer here is age of fetus. Indication of acyclovir in pregnancy is A. Disseminated herpes, B. Chickenpox in first trimester, C. Prophylaxis in recurrent herpes, D. All of the above. It is D. All of the above. Human placenta is A. Discoid, B. Hemochorial, C. Deciduate, D. All of the above. It is all of the above. Human placenta is discoid because of its shape, hemochorial because of direct contact of chorion with maternal blood, and deciduate because some maternal tissue is shed at partition. Hot flushes are experienced as a result of A. Increased noradrenaline, B. Decreased estrogen, C. Increased noradrenaline and decreased estrogen, D. Increased noradrenaline and estrogen. Increased noradrenaline and decreased estrogen. Hot flushes are caused by noradrenaline, which disturbs the thermoregulatory system. Estrogen deficiency reduces the hypothalamic endorphins, which release more norepinephrine and serotonin. So the correct answer is C. Cephalic index is A. Biparietal diameter by OFD, BPD by SCG, SC, COFD by BPD, and HC by FL. Cephalic index is BPD by OFD. Biparietal diameter divided by occipitofrontal diameter. In MRKH syndrome, which among the following is absent? A. Vagina, B. Breast development, C. Pubic hair development, D. Testis. See, MRKH syndrome is also known as MURCS syndrome, Mullerian agenesis, renal aplasia, cervicothoracic somite dysplasia. MRKH, that is Mayer-Rokitansky-Kuster-Hasse syndrome, has a karyotype of 46XX. So the gonads present are ovaries in contrast to androgen insensitivity syndrome, where testes are present. The MRKH syndrome is characterized by congenital aplasia of uterus, upper part of vagina in women showing normal development of secondary sexual characters. It is testis. Polyspermy is inhibited by which ion? A, Ca, B, Na, C, K, D, Cl. It is Ca. The calcium wave amplifies the local signal at the site of spermatocyte interaction and distributes it throughout the oocyte cytoplasm. The increase in calcium concentration in the signal that causes the oocyte to resume cell division, initiating the completion of meiosis and setting up developmental program that leads to embryogenesis. Maximum amniotic fluid is at A 32 weeks, B 34 weeks, C 36 weeks, D 40 weeks. Fertilization usually occurs in which part of fallopian tube? A fimbrial and B ampulla. C interstitium, D isthmus. It is ampulla. Fertilization is the process of fusion of spermatozoa with natural organ. Physiologic change in leukocyte number in pregnancy is A neutrophilic leukocytosis, B lymphocytic leukocytosis, C neutropenia, D basophilic leukocytosis. It is neutrophilic leukocytosis. Weight of uterus at term is A 400 to 500 gram, B 600 to 700 gram, C 800 to 900 gram, and D 900 to 1000 gram. The uterus in non-pregnant state is about 60 gram with a cavity of 5 to 70 mm. and measures about 7.5 centimeter. At term, it weighs about 900 to 1000 gram and measures 35 centimeter in length. Please click the link in the description box to join the ultimate 2-day Neet PG Breakthrough Blueprint Masterclass. The first 10 people who will click the link in the description box will get this class absolutely free. Urinary retention earliest in pregnancy is at A 10 weeks, B 18 weeks, C 22 weeks, D 34 weeks. Urinary retention in pregnancy is rare. It is classically described in some women with retroverted uterus, which becomes impacted in pelvis, usually seen earliest between 18 to 8 to 12 weeks of pregnancy and causes outflow obstruction. Down syndrome is earliest diagnosed at A 8 to 10 weeks, B 10 to 12 weeks, C 12 to 14 weeks, D 14 to 16 weeks. Earliest diagnosis of genetic defect can be done by use of Coriolanus sampling. Coriolanus sampling is carried out transcervically at 10 to 12 weeks and transabdominally 10 weeks to term. It is 10 to 12 weeks. When is folic acid started in pregnancy? A 4 weeks prior to conception, B 8 weeks prior to conception, C 4 weeks after conception, D 8 weeks after conception. It is 4 weeks prior to conception. Folic acid supplementation 4 milligram per day is started 4 weeks prior to conception and continued up to 12 weeks of pregnancy. This can reduce the incidence of neural tube defects. Term placenta weight to baby weight ratio is A 1:3, B 1:4, C 1:5, D 1:6. The placenta at term is a circular disc with a diameter of 15 to 20 centimeter. It has thickness of 3 centimeter at the center. It feels spongy and weighs about 500 grams. The ratio of placenta at weight term and the baby weight is 1:6. It occupies 30% of the time. 1:6. Persistent OP position is most common in which pelvis? A. Android pelvis, B. Gynecoid pelvis, C. Anthropoid, D. Mixed. It is android pelvis. Pregnant uterus will compress ureters at A. Pelvic brim, B. Uretrovesical junction, C. Trigone, D. Uterovesical junction. It is A. Pelvic brim.